Hi, I'm Dr. Bomer. Thank you for joining us today in my anti-aging series. We're going to be discussing feminine rejuvenation and more specifically vaginal rejuvenation. I have Linda Esposito joining us, and she has been a nurse for over 40 years and a gynecology nurse for 10 years just before joining our practice, and been in our practice for over 2 years. Nice to have you.
Happy to be here and excited about ThermiVa.
Yeah, and that's what we're talking about, a great new treatment that we are excited about and I've brought to our practice called ThermiVa. It specifically is designed to rejuvenate our vaginas. So why would we want to rejuvenate our vaginas? Well, they do age as we continue down the road, and some of the things that occur is our outside tissues, our labia majora and minora, get more loose and saggy. And the inside of our vagina gets also loose and saggy. It can even get to the point where it can fall out. And so the muscular wall gets saggy and atrophies. And also we can tend to have problems with leaky bladders, so we leak urine out. And orgasms can sometimes be difficult as well as we continue to age. The moisture in our vagina tends to go down as well, and when the moisture goes down, that is associated with hormone loss. And we tend to get more discomfort with sex when we have less moisture, and then just the quality of the mucosa, which is the skin inside, deteriorates. And these are all the reasons that we would like to rejuvenate our vagina. And so ThermiVa can actually address all of these concerns. It's what's wonderful about it, in addition, it really has no pain during the treatment, mild discomfort but no pain. There's no downtime at all. You can go right back into normal functioning, even into sex if you like. And after 3 treatments that are 30 days apart, the results can last up to 1 year. And it really is good for any age. So women that have some of these concerns that are younger can also benefit from this treatment. So how does ThermiVa work? Well, it works with this probe, which is not very large. It's very comfortable to insert into the vagina. It works via radio frequency, which gently heats the tissues up to a measured temperature that is controlled with the machine, the Thermi machine. And it is applied throughout the vaginal walls, the urethral area, as well as the whole external labia majora and minora, as well as the clitoral hood. There is no burning of tissue at all. Alternatively, there is a device on the market that utilizes, just as an example, CO2 laser. So CO2 laser, the way that works is it actually explodes cells and causes burning of tissue. And the way that works is it's inserted into the vagina and causes burning circumferentially of the vaginal wall throughout the whole vagina. And this has been shown to help women with painful sex and some urinary incontinence issues. But personally, the idea of burning anything inside my vagina is an absolute no. I would never entertain the burning and risk of scarring, and especially decreased sensation in my vagina with something like fractional CO2 laser. How do you feel about that, Linda?
I wouldn't do that either. I've seen what CO2 laser can do to your face, and I don't want to decrease any sensation down there. I know a lot of women say they tolerate sex better after the CO2 laser, but why just tolerate it when you can enjoy it?
Yeah. So I totally agree. So, we need to be careful in our quest for rejuvenation, that we stay in a safe zone, and we actually are really seeking just benefits but minimizing risk. And with the ThermiVa, there really is no risk, and that is the reason why I am very excited about bringing this into my practice and comfortable recommending it to everyone. Yeah. So now we're going to talk a little bit about the procedure. Both Linda and I have experienced the procedure. And so you might be wondering, what are some of the specifics? So how long is the procedure?
About 30 minutes for both inside and outside.
Yeah, and it goes by pretty quickly. In terms of discomfort, we're going to both describe what we felt during the procedure. So Linda?
I felt like a little bit of pressure and maybe like mild cramping, like period cramps.
Yeah, and I would say I felt that too. I felt a slight sensation of warmth, and not overwhelming warmth, but just a slight sensation of warmth. And then it really felt very similar to period cramp. And I think what that correlates to is the muscles inside are getting stimulated and actually spasming a little bit. And that shows that it's working. That's what we want it to do, is we not only just treating the skin there, we're actually stimulating the musculature for it to become stronger. So it is a very tolerable procedure. And so after the treatment, how did you feel directly after the treatment?
Directly after, I just felt normal, like I hadn't had anything done at all. And then already that night I noticed that I didn't have as much urgency and frequency to get up and urinate that much during the night.
So some of the reasons that you wanted to do the treatment
are for frequent urination, going at night, feeling urgency, like you got to know where every public bathroom is, and that's after I had already had a cystocele repair 5 years ago.
And how did that surgery work for you?
It worked too for a while, but the muscles get lax again.
Yeah, so it's a matter of tone, muscular tone.
Mm-hmm.
So what's so interesting about this, it's basically like exercising your vagina. You know, we have these muscles down there that get lax with age, and everything starts to fall down and wants to fall out. And prolapse is a common problem with women as they age. So this is like taking your vagina to the gym.
Exactly.
That's interesting. It's kind of what it felt like. The reasons that I was interested in having the procedure was that I have a little bit of urge incontinence. So when I feel like my bladder's full, sometimes it's hard to, keep it all in. And just the overall, look of the outside to improve the cosmesis of the vagina, and hopefully to improve my orgasms. So in terms of what I felt afterwards, I didn't feel like I'd had anything done. I actually put hormone creams inside my vagina with my finger every night, so I was able to feel the difference inside, and it felt very full. Like, it definitely felt different in that it was very tight and very full. And but other than that, if I hadn't done that, I wouldn't have noticed that I had had the treatment done. And in terms of being able to hold my urine, I definitely noticed that I was able to hold my urine much better for many days afterwards, and still today I'm still able to. It's been 2 weeks now.
2 weeks, yes.
Yeah. And for us, so 30 days is, you want to have 3 treatments 30 days apart. So in 2 weeks we're going to have another treatment. And I also noticed the first time that I had sex afterwards that it was much easier to get to orgasm, and also easier to have multiple orgasms. So I was very pleased with the treatment. And Linda, what would you say?
I was pleased too, with the issues that I was, concerned about.
Mm-hmm. And so you can see that there's different reasons why women would want to have this procedure. Some might want it just for more the cosmetic element and the sexual element, and if you have incontinence issues, it's certainly going to help that as well. And some women possibly have conditions where they feel very dry inside, and it's going to help with that as well. So it addresses a lot of conditions, and again, it's a comfortable procedure, and I'm looking forward to my next one.
Me too.
So who's a candidate for this procedure? Well, you need to be a woman, and and actually any age is okay. You need to have had a normal pelvic exam within the last 2 years, and you need to also not be pregnant. You don't want to be messing around with heat and a probe when you're pregnant. So those are the criteria for having it done, as well as also the desire to have rejuvenation of the look of it, to improve moisture, to improve any symptoms of urinary incontinence, and also to improve orgasms. And again, these are the probes here. They're very comfortable, they're small, they don't provide any pain, and they are disposable, so it's 1 probe per treatment, and then when you get your next treatment, you have a new probe. So thank you for joining us today. Thank you so much for coming.
Thank you.
You're welcome. And we're really excited for you all to experience the ThermiVa and feminine rejuvenation of your vagina.